single day, like I've always done and always will.
Passing these bills on the floor, making yet another stand.
Welcome to this week's edition of New York Now. I'm Chantal Destra. A new legislative package centered around menopause for women has been introduced at the state capitol. If enacted, the package would require insurance companies, employers, and the State Department of Health to provide resources for women going through this biological change. While it may be difficult to see movement on bills in the summer months, the bill's sponsor, Assemblymember Linda Rosenthal, says that she's been doing the work to build support in preparation for the next legislative session. For more on the legislative package, its impact, and the plans to garner support, we sat down with the Assembly member. Here's that interview. Thank you so much for joining us here today, Assembly member.
Thanks for having me.
Of course. Now, can you unpack the legislative package that you've recently introduced that would work to address issues women face dealing with menopause in the state?
Sure. Well, some years ago, I decided to try to eliminate the stigma around menstruation and periods. So I think it's about 6 years now, my bill eliminated the tax on tampons. And from there, we passed free tampons in schools, free menstrual products in schools, in prisons, in homeless shelters. I passed a law, first in the nation, which required ingredient labeling on all menstrual products and various other things, something about endometriosis, et cetera. And I thought, you know what, I tackled one end of the spectrum in a woman's life, and now it's time to go to the other when it comes to her reproductive health journey. And that is menopause. That is menopause that is shrouded in the same kind of stigma and shame, if you will, as the beginning, as menstruation. And so I looked into it and I saw that as a state, there are things that we can do to help make women's health more a priority, especially when it comes to what women go through when they begin menopause, perimenopause, and menopause. So one of the bills makes it unlawful for an employer to refuse reasonable accommodation for menstrual or menopausal related conditions. And so that means that employees would have to be provided information describing their right to reasonable accommodation and resources if they feel they've been discriminated against. The next bill is an insurance bill, requires that all private health insurers in New York State cover perimenopause and menopause care and treatment by licensed healthcare providers. And then the last bill so far requires the State Department of Health to create an informational pamphlet for patients with information on the stages of menopause, symptoms, and treatment options.
Yeah, thank you so much for unpacking the impetus of that legislation for us. And I'm curious, what are you hoping the lasting impact will be?
Women's health has long been considered not a priority. If you look at the history of clinical trials and clinical investigations into new drugs and new conditions, they've basically all been done on white men. Now that has changed and is changing, but clearly half the population is not a white man. And so women's bodies are different than men's. And so we need a health approach that factors in everybody's issues. And now with the new federal government really kind of dismissing a lot of health issues, especially when it comes to women and diversity, I feel like it's incumbent on us in New York State to address those issues. And so, there's a lot of mis and disinformation about menopause, and there's also a lack of information, any kind of information. And so my goal is to shine a light on this normal biological function and to see how we can help women in the workplace and live their lives without going through some of the pains and troubles that menopause causes.
And as you mentioned before, you've worked really hard on focusing on women's issues and having equity in the state. So how has that worked to impact the way that you've approached drafting this new legislative package?
Well, I've been in the assembly for some years now, and so I think I have a good understanding on how to appeal to a wide range of legislators, what is needed to get something passed, and how to take into account the role of the agencies and educating the public. And so, I think these three bills right now address some of the glaring gaps in legislation. So, for example, and I've spoken to various women who've gone through menopause or are in perimenopause, saying when they go to the office and it's too hot. Maybe it's not that hot, but for them it's hot. They need a place to go, even if it's winter, that's air conditioned, for example. Or if they need to stay home for a day, that's fine. Or if they need to work from home that day, that's fine too, without it becoming like a big deal. Just as in schools, kids don't want to have to raise their hand and go to the nurse when they need a tampon. They can just go to the bathroom now and get one. Same thing. So it's not something exceptional and causing trouble. It's just normal course of events. Yes, I'm going there. It's air conditioning, even if it's 20 degrees out, my body is overheating. And the same with the various other symptoms of menopause that we need to be understanding.
And the first bill of the package, as you mentioned, requires insurance coverage for menopause care and treatment. So can you walk us through how a measure like this would impact women financially?
One of the treatments might be hormones, but those are not always covered by insurance. There's loss of bone, so perhaps you need medication that addresses that. Higher cholesterol, sleep disruption. Perhaps you need to go to an expert in sleep disorders. There are so many permutations of symptoms, and that's another problem, that not all doctors are actually familiar with how to address the issues as well. So it's important that people can have free access, free as in, unfettered. They don't have to get 10 referrals to get to a licensed healthcare provider who knows how to handle these issues.
And how are you hoping to garner support for the package while lawmakers are away for the summer and away from the state capitol?
Right. Well, the session doesn't begin again until January, so there's plenty of time, to speak with people. I'm speaking with colleagues, sending emails, doing some media so that people can read about it. And in general, I think menopause and perimenopause is starting to emerge in the social media sphere. So people are learning about it, and I think they'll be eager to be involved in the effort to help women going through perimenopause and menopause.
And are you currently having conversations with the health department around this package? What do you anticipate their support being for the pamphlets that they'd be required to create under this legislation?
Well, I've passed numerous laws requiring pamphlets, and I work closely with them, whether it's a pamphlet about endometriosis, a pamphlet about lymphedema, which I did some years ago. I have a bill pending, a pamphlet about IUDs. So, I'm used to working with the different agencies on preparing these pamphlets, which, they can turn to experts in the field. They don't have to invent the wheel when it comes to compiling information. There are different groups, and there's certainly doctors and nurses and others who specialize in these different conditions, and they provide input.
And what are the challenges that you're anticipating with getting this package over the legislative finish line? And how are you going to work to sort of mitigate those challenges?
Well, any new bill has challenges. People need to become familiar with it, things like that. But I think the fact that perimenopause and menopause affects half the population, and having a woman governor, I think will help in moving these forward. There's no reason to oppose this. Of course, insurance companies don't like to have to be on the hook for coverage of certain, appointments and stuff. But, that's their job to cover appointments and health-related issues. So I don't expect opposition. It's just a matter of there are many pressing issues that we always contend with in session, so making sure this rises to the top.
And if the bills are signed into law and enacted, how much would it cost the state to implement them?
Well, it shouldn't really cost the state very much at all. Pamphlet will be available online, so people could download it. When it comes to insurance, a lot of this is funded under Medicaid at this moment. So this is about private insurance. And in terms of providing accommodations to women, this actually leads to greater productivity. We know that once women enter perimenopause or menopause, a good number of them quit the workplace because the physical symptoms and some of the psychological symptoms make it too difficult to adhere to a strict workplace requirements. So if you don't get the day off because you're just not feeling well, or you don't get to work at home, or the office is freezing or overheated, it's hard to work there during those circumstances. So this will enable people to work better, longer, and not leave the workplace. So I think all in all, it really will be helpful to employers, employees, and the work product.
And lastly, how are you hoping to build on your efforts through the summer, heading into the next legislative session in January? And are there any other issues that you're going to be focused on next session as it relates to women's issues?
Well, sending out emails, speaking to my colleagues, the usual thing we do when we're not in Albany. And, I've been successful in getting many laws passed. So I think this will be another one. I have a lot of housing issues that I'm looking forward to passing. I have bills about AI. I have bills about I passed a number of significant laws around sexual abuse and the Child Victims Act, the Adult Survivors Act, and so I have some more bills in that vein, trying to protect women before and after they are assaulted and making sure they have a path to justice. So those are some of the issues that I look forward to working on next session.
Well, that is all the time we have for today. Thank you so much for joining us, Assembly Member.
Thank you so much.
And we were speaking with Assembly Member Linda Rosenthal, representing the 67th Assembly District and Chair of the Assembly Housing Committee. In July, Governor Kathy Hochul signed a law that would require public schools in New York to have cardiac emergency response plans. Since then, the question has been, how will this be implemented? Supporters of the law have underscored that these safety plans can mean the difference between life and death in life-threatening emergencies. In this next segment, our Elise Klein dove into the implementation process and the impact of this law. Here's that story.
At the end of July, Governor Kathy Hochul signed a bill into law that would require public schools in New York to have cardiac emergency response plans. The bill, nicknamed Dacia's Law, was named after 12-year-old Dacia Sanders, who died from sudden cardiac arrest at school while playing basketball. At the bill signing, the governor stressed no family should have to go through what Dacia's family did, highlighting that while the school had defibrillators, they were locked up and individuals around were untrained.
And I believe perhaps her little life could have been saved. And her now 25-year-old sister, who was 9 years old at the time, would have grown up with an older sister. Teach her the ways of what it's like to be a teenager, young adult, and a mom. I'm a mom. It's really hard to think of the loss of any of our children.
Hochul highlighted the new law is supported by Buffalo Bills safety Damar Hamlin, whose life was saved on the field by immediate response after suffering sudden cardiac arrest. State Senator April Baskin, a Democrat representing Buffalo and the lead sponsor of the bill, said at a recent press conference that she is proud that the new law can honor her little cousin's memory and save lives.
Just as Mr. Hamlin is here with us today, I believe Daisha is here with us as well. I believe that Daisha is here smiling down on us, so proud that we are going to use her journey and her situation to save the lives of so many other youth athletes across the great state of New York.
Assemblymember Mikhail Salages, a Democrat representing parts of Nassau County and the lead sponsor of the bill in the Assembly, is also overjoyed that the bill has been signed into law.
Each school district is going to have at least a pathway to ensure that if there's a sudden cardiac arrest, individuals get help. So whether it's a student or a staff member, it's creating an environment where we could save lives. Because, in the event of a sudden cardiac arrest, survival rates drop about 10% every minute without a defibrillator or without CPR. So ensuring that there's a rapid, organized response is really going to change lives and save lives.
The new state law requires a variety of elements for cardiac emergency planning, including that annual safety training for schools include components of sudden cardiac arrest, reaffirm the designation of a chief emergency officer responsible for emergency planning, and update emergency protocols. The update to emergency protocols includes adding new requirements in the law for a cardiac emergency response plan. The new requirements would mean that each school district safety team must develop a written plan for responding to sudden cardiac arrest or similar life-threatening emergencies on school property during school-sponsored events. Kawita Adams, a former superintendent for Albany City School District and an advocacy ambassador for the American Heart Association, says the implementation should be very doable for schools.
It's part of the school safety plan that already exists. So this becomes just another component to ensure the safety and well-being of the students, faculty, staff, and community members that come to school sites.
The new law requires the plan to include venue-specific procedures, especially for athletic programs, and incorporate evidence-based guidelines. Adams says the American Heart Association has downloadable resources for schools to review.
You have to make sure that the machine is operable, make sure that everything is working, who's CPR trained. All of those things are listed. There's a checklist that we have. It's downloadable, and they can go through that very quickly to make sure that they are meeting those particular requirements.
Many advocates stress the importance of CPR training and access to automated external defibrillator devices, or AEDs, in a timely manner in the event of a sudden cardiac arrest. Ann Ferner, an advocate and survivor of sudden cardiac arrest, says when there wasn't access to an AED when she went into distress during a church service, the recognition from a stranger with a medical background of the health episode being a cardiac emergency and the act of CPR saved her life.
My husband turned to me and he said, do you feel okay? And the last thing I remember at that point was, I don't feel well. And now this part of the story was told to me. I collapsed into the pew. He yelled out for help. I know their names now at the time, but her name is Lori, came forward. She recognized it as a cardiac arrest immediately because of her background, which is kind of the key to this whole thing.
Ferner added the immediate response to a sudden cardiac arrest and knowing what to do can have a great impact on a positive outcome.
The immediate recognition makes the difference between person surviving and not surviving.
For Terry Daler, her son Vincent was not fortunate to have time and immediate response on his side when he went into sudden cardiac arrest. She says resuscitation efforts were at best moderate.
What happened was there were several minutes actually him going without resuscitation efforts, and that was 70% chance of survival rate being decreased. When he arrived to the hospital, Yale Hospital, he was deceased at that time. He never regained efforts.
Daler added there was no AED at the Airbnb he was staying at, and his girlfriend at the time didn't really know CPR.
And the dispatcher was giving her instructions, but he knew that she was extremely emotional and fumbling. So he instructed her to get help. Actually, what should have, as a nurse, I know you instruct the person, you don't ask them, do you know CPR? If you're stuck in an elevator where someone's about to give birth, we're not going to ask you, do you know how to deliver a baby? We're going to say, you're going to deliver this baby. So what should have happened with the training was he should have said, give some resuscitation breaths, then go get help. So he went quite some time without oxygen. And that, to me, caused some problem.
Daylor says while she doesn't know if the issues with immediate response were the reason he didn't survive, being prepared and knowing what to do can save lives. She says it helps take chaos out of the equation.
And to ask a civilian to have an action plan to start resuscitations is somewhat intimidating in a lot of ways. But I think if they have the knowledge and they read some pamphlets on it and they were educated about the AED defibrillator machine, it's not that difficult to use. The first several moments is crucial, and it will be life-saving efforts.
Medical experts say cardiac arrest can occur for a variety of reasons, including blood clots, side effects from medications, underlying conditions like cardiomyopathy, and even impact, being hit with the right amount of force causing heart arrhythmias. Dr. Robert Pass, the chief of pediatric cardiology for Mount Sinai, says sudden cardiac arrest means the heart is beating too fast.
Often above 200 to 250 beats per minute in a very disorganized and rapid manner, either in what's called ventricular tachycardia or more commonly ventricular fibrillation. And eventually, when the heart beats that rapidly, particularly with an arrhythmia of the lower chamber of the heart cannot eject blood adequately. And so patients will typically faint and then have what is essentially called a cardiac arrest.
Pass adds when this happens, patients are not getting enough blood and oxygen to their vital organs, which can cause sudden death. Pass says the underlying conditions of hypertrophic cardiomyopathy is one of the most common causes of sudden cardiac arrest, especially for children. He says other underlying conditions like Wolff-Parkinson-White syndrome and long QT can cause sudden cardiac arrest, and part of the issue for kids is they are not easily detected.
The majority of the time, if we examine a patient, we will not actually identify the condition. And that's one of the reasons why rarely this can occur, is that even if a patient is doing all the right things, is seeing their doctor, is having the proper follow-up, there are some of these conditions in the absence of an EKG or an echocardiogram, we may not be able to tell.
A less common cause is impact or commotio cordis. For example, Hamlin went into sudden cardiac arrest on the football field because he was hit with the exact amount of force at the precise moment in the heart's electrical conduction to cause the heart to go into distress. Dr. Pass says Hamlin is the perfect example of how critical both AEDs and CPR are.
He is completely healthy and completely fine, and it's only because the people who were the first responders had an AED, knew how to use it, and were confident in using it and performing CPR. And that's why not only he's alive, but he's a professional athlete, and his brain is completely fine because of the skill set and the equipment and the quick thinking of the people who were right there.
Senator Baskin agrees, saying at the bill signing in July that she couldn't help but think of Hamlin and how his life was saved because of the immediate response.
The nation watched as our beloved and talented athlete fought for his life right before us on the Bills field. Mr. Hamlin is still here today, and he is a valued member of the Buffalo Bills defense.
Pass adds that both CPR and an AED can help reduce the risk of death in sudden cardiac arrest and serious neurological consequences, but the timing is important.
If somebody does not have rapid response to it, and by that I mean in the first 2 or 3 minutes, it's been estimated that less than 10% of people will even survive such an event if it happens outside of a hospital setting.
He says chances of survival with immediate response outside a hospital can improve to about 70%. Parts of the new law will take effect this week, and other parts will take effect in about 5 months. Schools are required to have policies and procedures for response to sudden cardiac arrest included in the school's building-level emergency response plans by September 1st. By January 20th, 2026, schools will be required to implement district-wide school safety plans for cardiac emergency response. Some state lawmakers say they are confident in schools' ability to put emergency plans together. Assemblymember Steve Otis, a Democrat representing parts of Westchester, says he is confident in school officials.
I think that school officials, school board members, and superintendents understand what's at stake here. And so I think the planning process for this is actually not that complicated. The burden is not that high.
Adam says the best thing to do for schools as they work on these extra steps is to coordinate with their medical team.
I would think that school districts would work alongside their medical directors, healthcare professionals, to make sure that they are implementing properly.
While many advocates and lawmakers say this new law is a step in the right direction, there's more that could be done. Szilagyi says she is planning to advocate for more funding in the state budget next year for schools to purchase AEDs.
I'm still going to advocate for additional funds to give out to school districts so that they could buy more AEDs. In my thought, you can't have enough.
Adam says more funding will help schools who may not have enough AEDs or not enough working AEDs.
I think the funding is extremely important because an AED machine runs from $1,200 to about $3,000, and that's just the machine in and of itself. However, you have to have the maintenance of the machine to make sure that everything is still working so that if an emergency happens, it's not because, something doesn't negatively happen because it's a defaulted machine.
Some advocates say lawmakers should also look at areas where AEDs are not mandated and expand that accessibility. This is an issue that seems to be on lawmakers' minds for when they return to the next legislative session come January. Legislative measures in their development are unclear at this point, but budget conversations seem to be a priority for lawmakers on this issue. Elise Klein, New York Now.
Well, that does it for this edition of New York Now. Thank you for tuning in, and see you next week.
Funding for New York Now is provided by WNET,